Could you describe, if we compare Finland's situation to some other countries in Europe or globally, where we are and what has been whose role there to saving lives of patients?
Well, if we compare Finland to Sweden, so we have a totally different strategy for isolation. So the numbers in care and death is totally different from Sweden. We created prediction models. We created one based on the German model, one from Norway, one from Sweden, and in all cases we are in a lower level of patients and deaf people in ward. So situation in Finland is quite good at the moment.
Could you tell a little bit about Health Village, what it is in nutshell, what Health Village actually is?
Well, Health Village, basically, this is a service platform, and it's a bit more than just a service platform. It is a kind of also a combination of services, but also a way of building new services. So that's what it is. Well, Health Village is a cloud-based service, but then again, there are different services within it. So there is the service for professionals, there is the open service, and then there is a service for patients. So going group by group, I think that, well, actually, I don't have the professional side numbers, but on the open side, we are catering to, I think that the latest number was to something like 60% of the Finnish population. So basically, that is the amount of people that have been visiting the site.
Has been the role of Health Village during the Corona crisis, Aki?
Oh, well, Health Village has been kind of serving as the digital platform and also for serving as the kind of a guiding principle that how do we build them. So being a cloud-based service, it has been really, really quick to sprint up new services, new platforms and solution in the Azure cloud. So I think that has helped us a lot. And then again, having all this code base already there, we have been able to take bits and pieces here and there and modify them slightly. But the biggest impact is really that there are a lot of services that we don't have to tweak at all. We just use them as is. So for example, I could tell you that we have the authentication and authorization methodologies for professionals, which are not HUS employees, which is already done. So we just took that into use within our communities, and we will up to speed right up.
How about you, Mikko? Do you have anything to add?
Well, when we started with the Corona Bot, the limit of messages was about 500,000. So when we ramped the service up, so we needed actually over 1 million messages per in 1 week. So it's been great to scale with the Microsoft Azure platform and have those services up and running without that kind of problems that you are lacking resources and capacity.
Yeah, and I think you are using also Health Village as a remote health care platform, and I think it has been critical also during this situation that there hasn't been those disease for healthcare professionals and so on, or how would you say?
Today, 80% of patients are treated remotely, and in pediatrics, 50%. So they have been scaling up a lot of services in remote visiting and remote services.
But now we have been ramping up all this remote appointments. So basically, we are now back in treating patients, and have been able to actually accelerate that. So it's also one of the things that I think that is really good. If something good comes out of this pandemic, is that we are actually accelerating the speed of digitalization in our treatments.
Great. How about Mikko? Could you describe a little bit like totally new services what we have created during this Corona crisis?
Well, we started with Corona Bot, and after that we've been focusing on giving information through the bots to the national citizens, and now we are having new services.
Basically, what we did was we started with the kind of creating services for common citizens, more or less like what are the symptoms, so that there's a kind of a triage system, so that they know that what's going on. the next step was actually to combine that with the anxiety bot, as we told it, this kind of adopt it so that it's basically telling people who are anxious about the pandemic. So there are actually exercises and instructions that how to deal with that. And actually that has been really, really good. But from there on, we've continued to create services for our existing patients so that they know that what's different today, what do they need to do. And then the latest thing that we are now running is when the testing is ramping up. So we created again a bot which is kind of a coordinating so that all the testing sites are using similar criteria. So who is being tested and who is not, which is really, really important that we can coordinate that on a kind of a countrywide scheme. And then from there on, all this information is fed back to the database, which we just built. And the communities are now logging on and tracking the positive test results. And they can use this also the system for more or less like relaying information between communities.
For the management, we created a new platform based on Power BI, so you can have the latest information in your tablet or even in your smartphone. So it's a collection of reports which are based on our data lake information, which is updated every 15 minutes to this report. So it's near real-time reporting. It's in your pocket.
Okay, so when I see those guys in national TV, they are actually telling those reports what you have created by using Microsoft platforms and Power BI.
Yes, that's true.
Okay, so basically Health Villages, depending on the services, it's basically a lot of the information services are based on SharePoint. So we are using a SharePoint to kind of manage the content and distribute that. Then on top of that, the other services are created so that the patient-related services, we have Dynamic CRM as a database for our products and services and also customers. Then the rest of the stack, technology stack, is relying on Azure authentication, Azure security, and also Azure services, which are in the cloud. So basically, most of the services that we are creating today, they are based on microservice architecture, where the web applications are at the core, and of course the Azure databases are there behind it. Most of the databases that we're currently using are regular SQL databases behind the microservice, but then again we also have some experimentation with document databases and NoSQL databases. But I think that's pretty much sums it up. At HUS we are not doing all of this alone. So basically what we're doing, we are acting as product owners. We don't do that much coding ourselves. So for that we rely on our suppliers, and InnoFactor is one of them, and a very appreciated one. And they'll be providing the whole architecture, the whole stack from architecture to development and infrastructure maintenance. So this is also one of the key success factors that we have companies like InnoFactor who can wrap up in a fast pace the people and the resources and the skills that we need when we are in need.
Without InnoFactor, we wouldn't be here.